Hello, I'm Dr. Frances Pitsillis. I'm here to talk to you about a serious condition called lichen sclerosus, but for females in the genital region. You see, lichen sclerosus can affect men and women, but 10 times more women than men. And in females, young girls and postmenopausal women can get it in the genital area and not just in the body, but it can be purely associated with the genital area, and it's far more common than you think, and there needs to be a lot more awareness of this condition. And in fact, after a certain age, 25% of elderly women can have this problem. It's really when the problem becomes more seriously destructive of the tissues that we tend to worry. So what is it? Well, it's a condition that causes severe itchiness of the vulval area, the external tissues of the genitalia of women, and also the tissues become white, scarred and thin. And so it can affect all of the vulva and even the perianal tissue. It can extend backwards and have an hourglass sort of a shape. And we're not sure exactly what causes it. It's multifactorial. We do know that there's a genetic association because around 10 to 15% of women who have this have got a relative with it. So there is a genetic association. We know that there's an autoimmune component to it because some women have got other autoimmune conditions as well as developing this. And in this condition, there are antibodies to extracellular matrix protein 1 in 60 to 80% of women. So there's obviously an autoimmune component, which in turn means that there's probably an inflammatory component. What tends to happen with these women is that the scarring and scar tissue can be so severe that it can completely engulf the clitoris and scar down the introitus, the opening of the vagina, and make sexual intercourse very painful or impossible. It can really cause a lot of distress for women and a lot of stress on their relationships with their partners. So how are we going to treat this? Well, at the moment there are no satisfactory treatments that are mainstream. Most of the treatment is using a steroid ointment on the tissues, and only if really necessary a surgical treatment. But I propose that because of the origins that we know about, that the treatment should involve looking after internal health, because we do know that it occurs at least in older women after menopause. So we know that there are hormonal changes. We know that there are other autoimmune diseases in many of these women. We know that there are other autoimmune associations in most of the women. We know how to correct diet, hormonal balance, nutritional balance, and lifestyle to help reduce inflammation and reduce a tendency to autoimmunity in women. At the moment, I'm using experimentally low-level laser therapy in my clinic, which is a painless treatment, and it's used to promote wound healing and restore tissues. I'm also using the O-shot, which in a preliminary study has been found to be helpful. And the O-shot is the use of the patient's own platelets to inject into the damaged areas for wound healing and the healing responses. So what are the other things that women can do in terms of general measures? Well, they can be very gentle with their tissues and don't use soap down below. Avoid tight clothing, rubbing or scratching the area. Avoid riding bicycles or horses because it might aggravate the treatment. And use moisturizers to help moisturise the tissues as well as the steroid ointment and anything else that you've been prescribed. And also, please, 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 if you know anyone who has a very itchy vulva or who's having difficulty with sexual intercourse or pain with sexual intercourse, make sure that person gets help and gets a good diagnosis so that they can be helped.